Welcome back to The Price of Business. I'm your host, Kevin Bias, talking to you about you and your business. Got him on, the one and only Frank Granett. I love having Frank on. We have a time talking about mental health and how to look at mental health differently. Our ongoing joint project between The Price of Business, USDailyReview.com, and CAOOY.org on the business of ADHD and the price of ADHD business, that is. And always delighted to have you on. Tell us about the great news going on over there at CAOOY before you introduce her today.
Yeah, thanks a lot, Kevin. The great news at CAOOY involves we are now officially a nonprofit educational public charity. And what we do, Kevin, our mission mainly is to help parents help their children determine the cause of underlying behavioral challenges before premature drug use. It's not that we're anti-drug therapy. What we're looking for is how can we give that educational piece, especially to family members that are struggling with the wide variety of neurobehavioral disorders that are out there in America today. And so what we do is educate and make available all these groundbreaking assessments that are out there that parents can go to prior to premature drug therapy. And we also specialize in medication protocols. In other words, advising what the prudent course of drug therapy is if parents do decide to go that route.
Yeah, make sure that you check out our huge amount of literature over there at USDailyReview.com and PriceOfBusiness.com. We've got audios, we've got articles, pretty impressive anthology now of information there. Frank, tell us about your guest today.
We have a great guest today, Kevin. She is a board-certified psychiatrist specializing in eating disorder treatment, addictions, trauma, mainly PTSD, as well as all co-occurring type disorders. She is Chief Executive Officer and Medical Director of Timberline Knolls Residential Treatment Center in Illinois. And Dr. Dennis, it's great to have you on board with us today.
Thank you so much for having me. Happy to
Welcome
be here.
to the program. By the way, what part of Illinois are you in?
We are in a town called Lamont, which is about 30 miles west of downtown Chicago.
Very good. Go ahead with your first question there, Frank.
Dr. Dennis, and I looked at your website and we looked at the great work that you're doing at your residential treatment center. And before we get into the Adderall type of addiction treatment that you specialize at your center, I got to ask you this. What, as a medical student, then you went on to your residency, what compelled you to go down that specialization in psychiatry, and what kind of gravitated you to that route?
I'd always been psychologically interested, and I remember as a grade schooler really liking television shows where there were psychologists who were trying to figure people out and understand their behavior. So all along in my life, I'd been interested in what makes people tick and what makes people behave in the ways that they do. And then in medical school, I just really fell in love with the work of psychiatry and my inpatient psychiatry rotation. I ended up having a tough decision between psychiatry and one of the surgical subspecialties because I'm also very hands-on. I'm an athlete. I like to use my hands, and I like the concrete, which obviously we don't have a lot of in psychiatry. And then in my third year of psychiatry, ended up getting into my own recovery on some addiction and eating disorder issues, and just felt pulled to continue doing the work and giving back and pursuing psychiatry as a lifelong career and passion.
So the passion is the key word, and right now in America, as well as worldwide now, we're facing an Adderall type epidemic. Kevin and I had past shows featuring academic doping now that's on college campuses. We got suicide rates through the roof, second leading cause of death on college campuses now. At your center, just zero in and focus, if we can let our listeners know, what is the primary objective when you have, and you deal mainly with female adolescents as well as female adult population treatment. For Adderall addiction, what kind of course, can you give us a 1, 2, 3 assessment on what you're going after and how you get this person back on track?
Sure. Well, a lot of people come in with a diagnosis of ADHD. Some of that is legitimate and accurately diagnosed. Much of it is misdiagnosed. Patients that tend to become addicted to stimulants many times know ahead of time what to go into a psychiatrist's office and say in order to receive the diagnosis and walk out with a prescription for a stimulant. So we look at, pre-ADHD diagnosis risk factors for addiction or substance use disorders. We look at motivation for the person to have been on the stimulant. Even people who actually have the ADHD diagnosis who end up abusing or misusing the stimulant medication and becoming addicted to it. There are many different options that we can introduce them to have adequate control of the ADHD symptoms, but minimize the risk for ongoing addiction and dysfunction in their lives.
Let me ask a question real quick, Dr. Dennis. What is it about Adderall in particular that has led to such explosive growth in addiction?
Well, there are a couple of biochemical factors that we know are associated with a level of abuse potential for medications. And one of those is something called how lipophilic is the medication. And that's a term that means how quickly can it pass through fatty tissue. And the blood-brain barrier is very lipid-rich. So medications that can get to our brains extremely quickly and have their effect within minutes tend to have much more potential for becoming addictive. So many medications used to treat ADHD fall in this category. They're fast-acting, they're short-acting. People get an immediate response, and that tends to be a trigger for people with a susceptibility to addiction.
Your main program, is it 30 days, Dr. Dennis? Is that do you find that your patients are, like with Adderall addiction, are motivated? And is 30 days enough time to get them back on the road to recovery, or what are you finding at your center?
Well, it's highly individualized. Unfortunately, there's no cookie-cutter sort of approach that we can use with our women that are coming in addicted to Adderall. And it also depends on the person's level of motivation. Some people are highly motivated to get off of the medication and become sober. Other people are quite ambivalent. Some people come in just because their parents or spouses want them to be here. Those people tend to have a very, very hard time becoming sober in the long run, but some of them do as well. So 30 days may be an adequate start for somebody who's highly motivated. It also depends on how long they've been on the medication. The biochemical effects on the brain are somewhat dictated by the doses they've been taking and the length of time that they've been on it.
I got to wrap it up. Dr. Dennis, you have a website that you'd like to refer people to? Yes. Our website is www.timberlineknolls.com, and that's TimberlineKnolls, all one word. Very good. You can reach Frank Granett over there at CAOOY.org, and also make sure you check out Frank Granett at USDailyReview.com and The Price of Business. I am Kevin Price, and more for you right after this on this program.